There is a problem among people, not only young people, older people as well, of the use of recreational drugs. These are of various types. There are some street drugs that can be very deadly: heroin, cocaine. There are prescription drugs that can be equally deadly, and youngsters seem to have access to them. There is alcohol, which is a drug, and is frequently abused. And there is marijuana, a very common drug among young people. I'd like to say just a few words about marijuana, because there is much misinformation about that. People think that marijuana is safe because youngsters do not drop dead from an overdose of marijuana, such as they do from cocaine or heroin. And that gives a false impression that marijuana is a safe drug. But let's look at the fact. If someone takes 1 or 2 drinks of alcohol and 2 hours later does a blood test, you will probably not find a trace of alcohol, because the body detoxifies the alcohol within several hours. However, if someone uses marijuana on January 5th, and 3 weeks later, on January 26th, does a urine test, you will find traces of marijuana 3 weeks later, which means that marijuana, because it is fat soluble, not water soluble, can stay in the system for 3 weeks. Now, marijuana is used because somebody wants to get the feeling. And the feeling that they want to get can only be obtained because marijuana affects the brain cells. Now, just think logically. A chemical that affects the brain cells and sits in the brain for 3 weeks can be innocent? That's rather absurd. I think one of the most important symptoms of marijuana in young people is what we refer to as the amotivational syndrome. It takes away their motivation and drive to do something for themselves, education and training. And what happens is that these youngsters drift rather than steer themselves through life. And if they come to their senses years later, I mean, they may have begun using marijuana at age 14 and 15, and then when they are 31, they discover that they've really gone nowhere with their lives. They've just wasted the 16 most precious years of their lives for training and education. There are other effects of marijuana, negative effects, but I think that this is the one that overwhelmingly puts marijuana in the category of dangerous drugs. But because the danger is not imminent, and so a youngster does not seem to be doing well in school or in yeshiva and is dropping out, they don't see this as a catastrophe. But it is a catastrophe because the youngster is losing the most valuable time in his life. Now, why do youngsters use drugs? Why does anybody use drugs? Yes, we use drugs such as painkillers to relieve us of pain. And that's probably why everybody uses drugs. People who are happy with life do not go for drugs. They go for drugs in order to get rid of some feeling of discomfort. And there are so many feelings of discomfort that youngsters have. We are a complex society, very competitive. And if a youngster does not feel adequately loved, adequately secure, adequately capable of making his or her way in life, they can be easily persuaded to just try something to make them feel good. And since these chemicals do make people feel good, at least for a little while, they tend to resort to them. No one runs away from pleasure. No one seeks drug relief from feeling good. And there are so many, many reasons why young people may feel odd, may feel low self-esteem, may feel inferior, may feel that they don't have a chance to make it in the world. And it's these and other unpleasant feelings that will cause them to seek the chemical feeling of feeling high. And I think that ideal parenting, and we've talked about this previously, ideal parenting, and by the way, no one is born an engineer, no one is born a doctor, no one is born a lawyer. It takes training to become a specialist. And I think parenting is the most specialized function that a person can have. I don't know why we assume that we are all naturally born good parents. We can't rely on the fact we're going to raise our children the way we were raised. First of all, it's not the same world in which we were raised. Secondly, I'm not so sure that the way we were raised was ideal either. And I think it's crucial that young people learn good principles of parenting before they have their children, and continue this education as their children grow. I think that if we do that, then we can provide a pleasant home for the children and give the children the feeling of security that they need, the feeling of confidence that they can succeed in life, and that is without question the most important factor to help children avoid the plague of drugs, which is now rampant in the world of youth.